So you heard the announcement there. The meeting is being recorded, so we obviously will have this up so you can review it later on. And tonight we are doing an overview of the episode Quality Improvement Program with a GI focus. So MedChi and the HSCRC have been working together since 2017, 2018 to develop a specialist advanced payment program. This has gone through various iterations and lots of discussion over the last 4 years. The HSCRC worked with MedChi and the Maryland Hospital Association to create a group of interested parties that has now risen to about 60 or 70 folks who regularly attend meetings and have worked collaboratively to develop EQIP. And we're very excited about the program and look forward to having a lot of people sign up for it this summer, because I think we've developed something in a way that can be positive for physicians and hospitals in Maryland. Tonight's event is certified for CME by the Maryland State Medical Society, MedChi, and by the ACCME. So I will show you the link in a second, and I'll put it in the chat so you can fill out a very simple online form and get a credit of CME tonight. So please do that. Since it is CME, I just need to disclose that none of the people who will be presenting, myself, I'm the CEO of MedChi, I'm Gene Ransom, Maddie Jackson-Fowle, who is the Chief of Payment Reform at the HSCRC, Tequila Terry, who's the Deputy Director of the HSCRC, and Jessica Heaslop, who is with CRISP, which is the Health Information Exchange. None of us have any financial interests or conflicts. Obviously, Tequila and Madeline are state employees who work for the Health Services Cost Review Commission. I work for the Physicians of Maryland, running the nonprofit that is the Maryland State Medical Society. And Jessica works for CRISP, which is the HIE for Maryland, and they're going to be doing some of the data and reporting and quality work on this program. The evaluation link is there, but don't worry, in a second I'll put it in the chat so it'll be easy for you to fill out to get your one credit. So just from a background point of view, Maryland is very unique when it comes to payment models. And we're very excited that we have this ability to create advanced payment programs in Maryland on a state basis. This is something that no other state really has been able to do. And a lot of specialty societies on a national level have tried to get advanced payment models created and have been unable to be successful. But Maryland actually has a pretty impressive history of doing this. And I won't go through all the advanced payment models that we've developed in Maryland, but the HSCRC actually has a couple hospital-based models they've had in the past, HCIP and others. But on the physician side, to really focus on physicians, the very successful Maryland Primary Care Program is an example of an advanced payment model that we have developed here in Maryland that almost 2/3 of adult primary care doctors in Maryland have participated in. And you probably know from your colleagues that it's wildly popular among the physician community. So building on the popularity of that, we really wanted to develop something for other physicians who didn't fit into that, like you guys, GI docs. And the idea of doing that is that we would create an advanced payment model like the Maryland Primary Care Program. The reason that we're able to do this in Maryland is because Maryland has a unique payment structure and a unique deal with the federal government. We've actually had this deal since 1977, which was the first year that we were on rate setting. And it used to be called back in the day the Medicare waiver. It's now referred to as the all-payer contract or the total cost of care agreement. But essentially, this unique arrangement with the federal government allows us to do this. Now, the hospital situation over time has changed. Originally, from 1970 to about 2010, hospitals used to get paid rate setting that was actually set by the Health Services Cost Review Commission. That changed in that 2010 to 2018 period. We converted to global budgets for hospitals. And that meant that we really changed the way hospitals thought and dealt with issues around population health. The most recent waiver that was signed in 2019 thinks about the total cost of care. And that means that we want to start aligning physicians. Now, as you all know, as physicians, you're not part of the waiver, you're not part of the hospital rate setting, all of your payments are separate, and that remains the same. The issue is, though, this agreement with the federal government really needs to have alignment. And that really creates a situation with a perfect storm, essentially, where we're able to go to the federal government and get programs like this approved. And essentially, the HSCRC has been working collaboratively with MedChi, the Hospital Association, physician specialty groups, individual physicians, and others to try to develop something so physicians' work can be aligned with this hospital payment contract. And what we've come up with after lots of negotiation and work is EQIP. And in the first year, the federal government and the HSCRC has decided to start and essentially have as the guinea pig specialties under this program. And hopefully we'll have a lot more and a lot more codes, but they've decided to start with cardiology, ortho/neurosurgery, and GI. So having said that, I'm going to go ahead and turn it over to Tequila, and I'm going to stop sharing my screen so Tequila can share hers, or Maddie can share hers, and we can go through exactly what EQIP will look like for the GI folks.
Excellent. Thank you, Jean. And good evening, everyone. Welcome to today's session. My name is Tequila Terry, and I'm with the Health Services Cost Review Commission. And we're so delighted to be here today to discuss our new physician-focused episode quality improvement program, or EQIP, as you'll hear us refer to it as throughout today's session. I'm joined by my colleagues, Maddie Jackson-Fowle, who's the Chief of Payment Reform at our agency, and Jessica Heaslop, who's a program manager at CRISP, and they will be helping to present on the details of the program. Next slide. So our plan for today is to give you an overview of EQIP and to talk about particularly performance year one and the policies